Hi everyone. Welcome to RSB Healthcare Consulting. For more medical billing tips. 1. Get your credentialing and licensure in order. All insurance billing is predicated on physicians being credentialed, but the process has become increasingly difficult due to payer and state-specific requirements. Whether you are a solo provider managing your new practice or you are a multi-provider practice adding a provider to an existing facility, you need to start the credentialing process early. Target 150 days before the provider plans to start seeing patients to begin credentialing. 2. Use CAC to simplify payer enrollment. Working with payers is not always easy, but thanks to an initiative from the Council for Affordable Quality Healthcare (CAC), provider enrollment with payers is a little simpler than it used to be, giving you less reason to reach for the ibuprofen. CAC, a non-profit alliance, has several different initiatives focused on streamlining the business of healthcare. CAC strives to be a catalyst for industry collaboration on initiatives that simplify healthcare administration for health plans and providers in pursuit of higher quality care for patients. One of CAC's programs is ProView, an all-in-one platform where providers can submit, store, update, and access the information they need to work with payers. Credentialing, claims processing, and quality assurance are all included in ProView, with credentialing being the primary service. Payers working with CAC can use ProView to electronically download participating providers' information into their systems. CAC asks for minimal information from your practice during the registration process and handles sending your enrollment information to the payers you select. Best of all, it sends payer payments directly into your bank account. Combining CAC with an efficient medical billing service can do even more to streamline processes at your practice. 3. Implement time-based coding for ENROLLMENT services. Sometimes a visit goes long, an extra 5 or 10 minutes, and it throws off your morning schedule. A visit often goes way too long, an additional 20, 40, or even 60 minutes, and it practically wrecks your entire day's schedule. The 2021 Evaluation ENROLLMENT Management Coding, ENROLLMENT coding, allows practices to account for this situation by billing based on the total time spent on an encounter with a patient, including both face-to-face and non-face-to-face time. When used for ENROLLMENT billing, time is also used to determine the appropriate code level for indicating the complexity of medical decision-making. Time spent on the following activities can be billed as ENROLLMENT services provided they are accompanied by the appropriate documentation. Reviewing tests in preparation of a patient visit. Obtaining and/or reviewing separately obtained history. Performing a medically necessary appropriate examination or evaluation. Counseling and educating the patient, family, or caregiver. Ordering medications, tests, or procedures. 4. Split names into columns in Excel. This may seem like a minor medical billing tip, but it's quite important when you're working with large databases of patient lists. In those lists, it is very common for the patient's first, middle, and last names to be combined into one single column. This makes it impossible to sort or filter the data based on the patient's last name. Splitting the single name column into multiple columns for first, middle, and last names makes it much easier to organize and manage the patient list. Fortunately, this is quite easy to do even if you've already entered names into a single column. Thank you for your time. Contact us to collaborate on our email info@rsbhealthcareconsulting.com or our website www.rsbhealthcareconsulting.com.